cholera, right? Hey, sorry, tuberculosis. I'll edit that out.
Tuberculosis is caused by two bacterial pathogens. The pathogens live inside human cells, particularly the lungs. The lungs are the first site of infection. The bacteria eventually spreads through the whole body, at the end infecting the bone tissue. Okay, so it's caused by two types of bacteria, Mycobacterium tuberculosis and Mycobacterium bovis. Mycobacterium bovis is mainly found in cattle, which is the reason why unpasteurized milk and uncooked meat are a big cause of tuberculosis in undeveloped countries. Okay, as you can see, these are rod-shaped bacteria, and these bacteria actually divide slower than normal bacteria. They only divide every 15 to about 20 hours, which is very slow compared to other things, other bacteria which can divide every 20 minutes. So they're taken up by the macrophages in the lungs, where they continue to multiply. So the arrows on this indicate the infection of tuberculosis in the lungs from a chest X-ray.
So the methods of spread. TB is mainly spread when an infected person with an illness coughs or sneezes, and bacteria is carried in the air in the form of tiny droplets. And transmission occurs in uninfected people when the infected person, when they inhale the tiny droplets. The form of TB caused by M. bovis is spread to humans through uncooked meat or unpasteurized milk. It mainly attacks people living in poor conditions and in overcrowded areas, and people are more prone to TB in inner cities, mainly in developing countries. The movement of people, as you can see, can also affect a large number of people with TB. As I said, it can occur only in crowded areas. As people move from one place to another, any one of them can carry the disease, and it can spread in the air in the form of tiny droplets.
Okay, so how does TB work? So as you said before, it is airborne infection, meaning that you have to get it when you cough or sneeze from an infected person.
Cough now.
Okay, so how does it enter the body? So it has to enter through the nose or the mouth and goes down to the trachea, the bronchioles, and eventually ends up in the alveoli, where most of the stuff happens. Now I'm going to draw this one.
Yeah.
Okay, so there are 4 different scenarios here. So the first one, okay, so the first scenario here, nothing is going on there, because we have to remember that the spread of this is through a bacteria. So when someone coughs at you, there's a large distance for the bacteria to travel to you. So in this first case, it didn't reach you. So your alveolus is clean and nothing's going on. In the second case here, can you see the dots there?
Yeah.
Yeah, so that's the bacteria. Now, what your body does is that there are macrophages within your lungs just traveling randomly, finding these bacteria, and they'll come here and engulf these bacteria and try and stop it. In scenario 2, they are successful in destroying this bacteria. So I'll color this in. And that is as much as that's all that happens in this case. So safe. In scenario 3, the same thing happens. Macrophages comes and engulfs the bacteria, but this time they are unable to break through the cell wall of the bacteria, so they just stay there in the macrophage. Stays there, nothing really happens after that. In this case, number 4, there's several different ways. Either you're really unlucky and you get more than 2 bacteria in this alveoli, or they replicate within here. And then that becomes a problem. So from this, the 2 different types of infections, you can class these 2 as latent, and this one is active. Latent meaning that it's inactive and it just stays there until it's reactivated. And active TB is when it actively replicates and becomes a problem. Alright, so primary infection basically is when these macrophages, which contain the bacteria, they start to replicate within the macrophage, and eventually there will be too many inside this macrophage. So what happens is the macrophage will allow some of the bacteria to come out of the cell, and other macrophages will come in and engulf it as well. This it's an attempt to try and stop the spread of the bacteria. Ultimately, it forms when all these macrophages with the bacteria in them, when they come together, scientists call it as a granuloma over there, which is basically an inflammation within the lung. Now, if you don't get treatment, this infection can move towards the lymph nodes and it gets inflamed there. And you can see this within a chest x-ray. Lymph nodes will come out as slightly darker, while this granuloma will turn out as the circular white spot, which is basically the dead macrophages, which have calcified, and that's why you can see them on the chest x-ray. Another thing is primary infection, which is progressive, which is active TB. What happens is there are 2 possibilities. It either stays in the lung, which we call it as local infection, and that eventually becomes pneumonia. And the second scenario, which is only about 5% of people who get active TB, get this side effect, which allows the bacteria to move around the body. So common organs which they will go to would be the liver. They can move to other parts of the lung as well, and they can go to the brain as well. Okay, latent tuberculosis is basically a secondary infection, and it's these 2 stages here, when they just stay inside the macrophage, and for them to come out, they need to be reactivated, and this happens when, I think the most obvious one would be when you get reinfected. So if you're constantly hanging around someone who has tuberculosis and they constantly cough in your face, you get it. Another one would be a weak immune system. So this is when HIV comes in, because HIV, comes in, kills the T cells, can't do anything. Then these guys come out and wreck. Other ways. Staying on with the immune system, receiving a transplant is quite deadly as well, because doctors will give a drug which will reduce the immune system or weaken the immune system so that your body won't reject the transplant. And this is when, if you have latent TB, they come out and they have fun.
That's a nice one.
Okay, so just to finish off, after they come out, they literally follow the passage of the active TB. They come out. They can either stay in the lung for pneumonia, or they can move around the body and go to other organs.
Okay, the diagnosis and treatment. The diagnosis is very important because if diagnosis is very important to stop the TB from spreading further. The three different methods are mental skin test, chest X-ray, and sputum cultures. In the mental skin test, the doctor basically injects intrahepatic liquid into your skin, and later in 48 to 72 hours, the skin either turns red or swells up. People who have HIV or any disease that affects the immune system, we have no response to this test. In the chest X-ray, if the chest X-ray is normal, then the person does not need to do any more tests. But if the chest X-ray shows the signs of any disease, further tests need to be that's a chest X-ray with positive TB. In sputum culture, basically the doctor takes the sputum of the patient and checks under the microscope if he has TB or not. The treatment for latent TB is actually very important because if it's not treated, it can develop into active TB, and that's more worse. So the people who do not take proper medication for latent TB, they can develop into active TB, and the treatment is longer. Yes, the treatment for latent TB, the medicine that's used is isoniazid, the INH. The doctor uses this treatment for 6 to 12 months. The antibiotic, INH is an antibiotic that kills the TB bacteria. The effects are vomiting, nausea, and liver function abnormalities. The treatment for active TB, when a person is diagnosed with active TB, the person is first of all isolated from other people for 2 weeks because the medicine takes at least 2 to 3 weeks to kill the bacteria. The CDC recommends that the people take several other drugs in addition to INH like rifampin, ethambutol, streptomycin, clamazepam. Yeah, this is actually very important because right now the multi-drug resistant TB is rising. This basically is that if a person who has TB, they take the medicine, they do not complete the dosage, and the bacteria that survives, they form the resistance towards the antibiotics. So next time, if the person takes INH or any other antibiotic, it won't work. HIV counseling. This mainly because if a person has HIV, there's a high chance that he or she has TB also. So a blood test is recommended.
Hi, I'm going to talk about social impacts, economic impacts, and this relationship with HIV, and some irony that's happening around the world right now. So to begin with, I will add more description of Umang's work, which is MDR tuberculosis. What XDR? MDR stands for multi-drug resistant tuberculosis, and XDR stands for extensively multi-drug resistant tuberculosis. So let's say there's tuberculosis A and B, and you use isoniazid to kill this bacteria A. So this B survives, and they have fun, they reproduce. So let's say you have all the bees. Use the isoniazid again, then they kill the only eggs again. So the bees survive and they grow the resistance. This repeats again and again and again, and that's when this NPR or FDR develops. So I go to my social impacts and economic impacts. So this kind of disease is happening in usually underdeveloped countries. And just social impacts. Let's say someone nearby you coughs like really severely. Let's say can you come here? Let's say he sneezes like maybe 5 times. Then what I try to do, I try to avoid him, right? So they have really low quality of life because people will try to avoid you as much as possible they can. So if Adam is here and he's sick, unacceptable, I try to go out of the room. And as you see the statistics or the reading here, a lot of women are having the tuberculosis, and the children under them are orphaned or they die because of that as well. As I said earlier, this TB is prevalent in these underdeveloped countries. And what this TB does is that they try to rob the countries at $1 to $3 billion, trillion dollars. Right, $1 trillion over the next 10 years. These countries are freaking poor and they're going to rob like $1 to $3 trillion. Okay, these are statistics, boring statistics, so next one. I had a graph there. So these tuberculosis are usually from latent. Actually, 1/3 of us are infected. 1/3 of the population. However, they're all latent. That's why you don't see them. And they become reactivated when you're either sick, when your immune system is weak, or when your immune system is suppressed by other drugs. So HIV is one of the case, and sometimes asthma or some kind of this over immune system activities. And when you try to suppress them, you try to suppress your immune system, and therefore the latent tuberculosis get activated. So this HIV is closely related with TB. Next.
Okay, this is Dr. Rock's special question. Why is tuberculosis more prominent in the modern era, even though there are improved health facilities? One of the main reasons is HIV, as Justin and Human and Ryan said before. People with HIV are more likely to become sick with TB as well as other people suffering from diseases that impair the immune system. So a rise in HIV is always followed by a rise in TB. Multi-drug-resistant TB, as said before, the strains of TB bacteria are resistant to drugs due to maybe incomplete courses of treatment, incorrect uses of drugs, or faulty medication. Another reason is due to the use of the same standard TB drugs for so long that they fail to respond to the most common first-line drugs used to treat it, such as ionizing and rifampicin. And the third reason is actually tobacco smoking. Smoking damages the lungs and harms the immune system, making smokers more susceptible to TB. Smoking also reduces the effectiveness of the TB treatment and drugs, which can lead to longer periods of infection and possibly more severe forms of TB. People who smoke with latent TB also increase their risk of developing active TB.
You're supposed to tell that's all, folks. Okay, on the light. Shoot the questions. Yes.
Who was the first one to have tuberculosis?
Who's the first one of what?
Who was the first one to have this disease? The first person to have this disease.
Dunya, your question is not relevant. TB is not a special kind of disease to record, you know, the first one or the second one to have it and all
I know
that.
that, so we can.
Okay. Thanks for the question. Any other question? Adam, you are writing something. So I thought. Any other question? No. No means I have to ask hard questions. Any questions from the visitors? Cash, ask lah. Yeah, I have a question. Yes.
What are the symptoms?
They didn't tell the symptoms just now.
Coughing, sneezing a lot, you become very thin due to the loss of nutrients. Not like Ryan, not like Ryan. Looking like that eventually.
Oh, okay.
You are very skinny, okay?
Chill.
She's so mean.
Ryan is fit.
Yeah, it's called
Yeah. He's fit. Any other questions? Okay. No questions? Try to think. Shoot them. You have Justin to answer all the questions. Oh yeah, what Adam is asking, would they cough off blood? What?
Cough of cases of lungs.
Pieces of love.
This was basically this is
And who told you that, Justin?
okay, let's say this is piece of lung. Yeah. Just like that. Then it's dead.
Adam, so what happened is when the person is constantly coughing, you see like what he said over here. Okay, let's say, okay, so let's say this bacteria attacks this alveoli. Okay, when the bacteria attacks the alveoli, what happened? The elasticity, remember what covers the alveoli? The elasticity, right? So the elasticity of the alveoli is compromised. Okay, so the alveoli surface has become like filled with holes, pores and something like that. So when you constantly cough, you know, like what we call is dry cough, okay, you cannot stop it. What happened is the pressure, coughing is pressure, sneezing is pressure. What happened is pressure builds up inside your alveoli and bursts the alveoli. And what happened when a section of lungs is burst, they will come out from your trachea and from your mouth or nose, ignore that sound, okay? Nose as a blood clot, okay? So it's like a lump of blood. That is actually not your blood, that is pieces of your lungs and alveolus. Okay, so what happened basically, you have decreased your surface area for gases exchange and you can die from that. And it's not a very fast death also, it's like slow and painful and suffering and so on. Understand? Okay, so don't get any of these infectious disease. You can get cholera though, but make sure you get your treatment faster. Okay, understand? So that's all.